So my name is Christina Montoya. I am known as the arthritis dietitian. I live with rheumatoid arthritis in Sjogren's. I am passionate about helping women with Sjogren's and RA to lead an anti-inflammatory lifestyle without unnecessary restrictions. Dr. Nikki is joining us from New Zealand, and she is a wonderful rheumatologist and a yoga therapist. So today we are going to discuss how to manage fatigue, energy conservation, and also minimizing weight gain during this time of year.
Many people may be traveling. They either may be flying cross country or taking road trips to visit family. And when you're stuck and you're not moving for several hours, it's really easy for the body and the joints to get really stiff. So if you have a chair, I can show you a couple of things that you can do to keep the blood flowing, keep the energy moving.
When I overindulge, that usually leads me to a flare-up and less physical activity, and then that leads to cancel plans. So I don't want to do that this month.
That's a really sensible plan. I think a lot of the people who are watching and listening, they will probably benefit from ways to help manage, keep their flare under control and not have one ideally. And we know that sugar, and I'm sure you'll tell us about this later, but sugar is probably one of the biggest driving factors for inflammation, isn't it?
It really is. But at the same time, you still want to enjoy it, right? Like you don't just want to put yourself in a corner. It's like, oh my God, I cannot eat the sugar, right? But it's about perhaps being more mindful. If you grab that cookie or that piece of pie, maybe just take your time to savor that piece of pie. So the brain can get the signal and say, I'm satisfied, I'm done, and then grab something else.
Often people's normal routines and habits, whether it's eating or whether it's exercising, or even whether it's remembering to take your medication, a lot of that goes out the window because many people are not working, kids are home from school, people are traveling, you've got visitors, you are visiting people, and it's very easy to kind of go out of whack, if you use that expression, but for your whole schedule to go out of whack. And that can mean that you miss taking your morning dose of your medication, or maybe you miss your breakfast. So it's really important. I love what you say. It's very important to be mindful and to prepare as much as you can ahead of time so that you are able to keep certain things that are important in place.
We don't want to really throw everything away. During the year, we have adopted these beautiful, healthy habits. We move, we get healthy eating, right? We meditate. But it seems that in December, it's like, oh, that's okay. I can let it go. January is coming back, and I'm going to lose all that weight. I'm going to eat healthy. I'm going to start the diet on January 1st, and that's where it goes. But it doesn't really work that way because then it's really hard to get back on that routine. So if you are able to keep it as long as you can and being consistent, even during the holidays, as much as you can, that's probably the best the best thing you can do.
People say that January 1st is when your New Year's resolution starts, but it can start any time of year, right? It can start in February, it can start on Wednesday, the 13th of July.
How to keep track of those anti-inflammatory pillars? So we're thinking about like anti-inflammatory nutrition, physical activity, movement, how to reduce stress, maintain healthy relationships. Just don't go and fight with your mother-in-law in December. So the way I created this, so it's like an anti-inflammatory track. So I just do like a checklist instead of you kind of writing down. It's like, okay, did I eat my healthy breakfast today? Check. Did I go for a walk? Check. So it's not that it's not too elaborate that you feel like it's too much for you to do.
A, fatigue is a common problem. B, that it is very much multifactorial. It is not just due to the fact that you've got inflammation, because we know that fatigue persists even when your inflammation is completely controlled and you're in remission. Fatigue is there. There may be nutritional or lifestyle factors. There may be poor sleep. There may be depression or anxiety. There may be a lack of social support. There may be much wider factors that all contribute into the sensation of fatigue. When my patients or my clients come to me and complain about fatigue, checking your medication, because sometimes your medication can be causing fatigue. checking that your inflammation is under control. And then often the recommendation has been to involve our lovely physical therapy colleagues or to involve our lovely occupational therapy colleagues. So it is really nice to see now the acknowledgement of not just healthcare professionals, but well-being professionals. So well-being is broad, isn't it? Well-being could be, to one person, it could be acupuncture, to another person, it might be yoga. But these guidelines have reviewed lots and lots of studies. There's been a couple of studies where they've looked specifically at yoga. They've looked at things like balneotherapy. There's all kinds of different modalities explored, but not in enough detail to wholeheartedly recommend one particular type of well-being modality. What do you think about that?
No, I think that's amazing. I think I mentioned to you before that probably just 5 years ago, all the well-being practitioners were not really recognized as part of the integrated management of inflammatory arthritis. It was just basically just take your medication, your biologic, and just go home. So I honestly feel that this recognition or acknowledgement, like you said, of all these different professionals, like from dietitians and physiotherapists, I think it just makes it so holistic, and also take that individual approach, right? So I do your yoga because I love it. I have to admit that I wasn't the one crazy about yoga. I really have to get into it, like learning from you, like you're so passionate about it. But one thing I love from our last live is doing the yoga nidra. I found that just so relaxing.
Yeah. Yes, I'm so glad you brought up the nidra. During the holidays and in fact in daily life, if you can just give yourself 20 to 30 minutes of time to sit or lie and listen to a yoga nidra, or if you can, even better, take some kind of restorative yoga shape where your body is fully supported and listen to a yoga nidra, that is, in my opinion, one of the best ways to conserve your energy, to feel rejuvenated so that your energy increases for the rest of the day. So if you do it at lunchtime or if you do it in the early afternoon, you'll probably find that in the late afternoon and the evening, you have more energy to tackle your daily life. So if you can incorporate that into your life, 20 to 30 minutes every single day, it will make a huge difference. I've seen it in myself. I've seen it in my patients and clients. I've seen it in so many people. And if you don't know much about restorative yoga, look at my Instagram. I spent the whole month of November demonstrating a heap of different restorative yoga positions and shapes. So it's the best way to elicit the physiological relaxation response. All right. And that's the science behind it. So I'll just kind of preface that by saying we think we know how to relax, and we really don't. We actually don't. We lie on the sofa, we watch on Netflix. I've been watching tons of Christmas, movies on Netflix. I'm guilty of it too. I'm definitely not perfect. But actually, we're not relaxing because we're receiving too much stimulation for the brain to actually shut down. Relaxation where you are actually awake is hard for most people to achieve, but yoga nidra and restorative yoga are ways to induce that. And when you actually reset your brain and induce that relaxation response, you'll naturally get your dopamine, your endorphins, you'll get all this oxytocin flooding around the body, your high cortisol, adrenaline levels, they'll come down, and you will feel more energized for the rest of the day. So that's my personal top tip for helping to manage your energy in the holidays.
To break down all those activities and try to keep them consistent. So when fatigue hits, it's not too hard to manage. For instance, I'm finding that in the morning is when I'm more energized. Getting my boy to school, going to exercise, getting some reading, preparing some presentations. And just when it's around 1 o'clock is when my energy levels starts to drop. So I don't rush myself. I just try to really follow your advice and say, getting in touch with myself and like that active relaxation and just basically slow down. I can stop. I can say no. What are those hours when you're more energized? and try to tackle the biggest tasks during that time. And then the rest of the time feel a little bit kind of taking it easy. That's what I'm finding that is helping me.
A lot of people do find that that lull in energy, that natural physiological lull after lunch or from lunchtime to, let's say, 3 o'clock in the afternoon. So that's the perfect time to do your restorative practices, assuming you have time and you're not having to go to work. If you do have to go to work, I don't know whether it's possible to find a quiet space where you can actually be undisturbed for 20 minutes during your lunch break, even if that means you go to the nearby park and you lie down. Really look at that. Try to make rest work for you. Try to prioritize it as you have done. And I love what you said about figuring out your own natural body rhythms, because there's going to be heaps of people here who are also night owls. So they feel most energized in the middle of the night and they're not morning people. And that's okay. But again, it's about working with your rhythm. So that doesn't mean skipping things. It just means shifting things around the clock so that you are still factoring time to sleep, factor in time to rest, factor in time to move, factor in time to reflect, look inwards, factor in time to laugh, all of that stuff. And it's definitely not one size fits all, but it is about knowing yourself. And so the more you know yourself, the more you can figure out what you need to do, what you need to adjust in your life. And that's one of the main reasons why I love yoga, because it really does help you to know yourself. You get to learn the good, the bad, and the ugly.
So when a patient is told that you had hit remission, what does that mean?
And it would mean that the person doesn't really have any tender joints when you examine them, or very few tender joints. They don't have any swollen joints, no obvious inflammation, and they feel that their pain scores are really low, and that the blood work, if it has a tendency to show high inflammation, in this case, it's showing normal. So if you have all of those things together, if they all come together, then you've got the perfect kind of situation where the person is in remission. So physically and clinically and on the lab work, everything is looking controlled. That's the best way to think about it. And I mean, certainly when it comes to remission, what we want is for you to stay there. Once you find this place, we want you to sustain that remission, to stay, for the next 12 months, 2 years, 3 years, as long as possible, without having such a bad flare that it makes you have to change your medication. So remission doesn't mean that you'll never have a flare. Okay. You might still get your one finger swells up every now and again, but when you're in remission, it means that if you have a flare, it's a very small thing compared to what it has been in the past. And you're not needing to change or increase your medication because the symptoms are much more manageable. The pain is not so severe that it's keeping you off work, it's keeping you off school, which is what a big bad flare does to you, right? And it goes on for weeks and weeks. So that's one thing I wanted to really make crystal clear. If you're in remission, it doesn't mean that you will never, ever, ever feel a swollen joint ever again, or you'll never, ever feel a painful joint ever again. It does, and it can still happen. But the key thing is it should definitely be happening far less, like rarely, infrequently, compared to when your disease was really active. Does that make sense?
Oh, absolutely. And even during that remission, I identify that I have a swollen joint, like in my wrist, and I can feel it, right? But that's the only one that is hurting. And also the pain as a result of the joint damage. Like it's not the rheumatoid arthritis that is active, it's just the joints are already damaged. So the doctor, like my rheumatologist said, like it's just, part of it, managing the pain. But like I say, it's manageable. I think my only worry when it comes now, more patients hitting remission, is the belief that, okay, so I'm lowering the medication. They go unsupervised and trying to maintain the remission with lifestyle strategies. Yeah. And I think that becomes really dangerous. I believe the data that I heard here in Canada is that if some patients can do that, so they hit remission, and they decide to just go on lifestyle management, but like within a year, they're already getting really horrible flare-ups. and they have to reassess the medication. It's like it's starting all over again.
Correct.
So
Yes.
I feel that it's just maintaining that balance. I told my rheumatologist, I feel happy that for the past 20 years, I led like a healthy lifestyle and I don't have any cardiovascular disease. And my RA finally under control. My major thing is fatigue. Like you said, even you're in remission, you still feel that fatigue that comes in and out.
Just come back to the point of medications though as well, and just a little reminder, a little plea that if you are taking medications for your arthritis, please do take them with you, and make sure you do take them regularly during the Christmas period. It can be easy to forget. If you think that life will be really chaotic, consider investing in do you call it a pill box or a blister pack, where the pharmacy pre-prepares everything you're supposed to take, the multiple doses, the multiple pills, everything is packed for you. So all you have to do is set some alarms on your phone that go off morning, lunchtime, evening, and you just take your pill or you take your injection. Especially important for your biologic injections if you are taking those for your condition. Just because if you're on a biologic, it probably means you've got more severe arthritis compared to someone who isn't, and so you really do need it. You really don't want to be missing doses unnecessarily, so that you can keep your Christmas, your holiday period, an enjoyable one.
If you're planning a trip, just make sure that you call the pharmacist or arrange with your physician, making sure that you have all the medication to cover for during that holiday. Be prepared. Like if you're planning that trip, also make sure that you have all your medication ready to go. If the biologic needs to be refrigerated, like get your ice pack, your little package there to get your prescription ready in case you need to show it like on customs or you're traveling overseas. So everything needs to be ready. I always, I rather buy my bikini over there if I forgot, but like not the medication.
Yes, it's very important. And also when you are flying, sometimes people have never been on an airplane with their biologic. They don't realize that it's a needle. It's going to be, reviewed by airport security a little bit more tightly, and often, depending on where you are, often you can get a letter of support from your rheumatology nurse specialist or your rheumatologist to say that this is the medication, and you can give that to the airport security officials. Practical things like carrying a chiller bag or an ice pack to keep your medication cool. These are all little things that you do need to think about before you're actually at the airport and being frisked by airport security.
Another thing is just make sure to pack lightly. Like I did this like last time I went to Colombia, honestly, just like even, I don't know, 2 sets of clothes. It's just essentials. Because we need to be aware that we don't know how our bodies are going to react in another country, another climate, and we don't want to hit that flare that we can't even like carry our own luggage. And I know it seems so silly, but it's a struggle. Like when you can't even manage your own belongings and then settle. So just make sure that just bring your essentials. Like don't overload yourself. Even if you have to wear the same clothes the next day, it doesn't matter.
One last thing, which I will just add about prednisone and steroid medication. So if you are somebody whose disease has actually been flaring a lot in the past few months and you are not yet in remission, and let's say you're somebody who has had to keep on changing their medication in the last 6 months because you can't quite get into a low disease activity or remission state. Basically, you might be somebody who's more prone to having a bad flare. So you might talk to your doctor ahead of time and ask about whether it's feasible. And this doesn't apply to everybody, but ask about whether it's feasible to have an emergency script of prednisone or prednisolone. So I will do this with some of my patients who I know well and who I know that are struggling. If they are going to be traveling overseas or going somewhere far away where they cannot access me easily, then I might give them or suggest to them maybe take a backup emergency supply of prednisone, a short course for like 2 weeks or 3 weeks, which you only use if you have a terrible flare of your arthritis, because that way it'll keep you moving. and it'll keep you going until you come back to the country or come back to see your rheumatologist. So that doesn't apply for everybody. It's just those folk who have had prednisone before and those folk who've got really, really active, uncontrolled arthritis. You still want to try to enjoy your holidays, don't you?
Probably a rescue remedy. I
Yeah,
used to call
yeah.
those. One of those things is just that an emergency. It doesn't mean you're going to stay there. And I feel that that's a very wise advice. My rheumatologist usually suggests that as well, that always she gives me like an extra prednisone if I'm going away, just in case. How to minimize weight gain during the holidays. And that's a
Oh,
tricky
yes,
one.
please tell me. Please teach me. I need this advice more
Wow.
than anyone.
It's like almost like fatigue, like when weight gain is multifactorial too, right? It's not just about all the calories coming in, but it's all the other factors that are maybe like, again, like if you're not sleeping well, if you're experiencing like depression or anxiety, right? In North America, let's put it as an example. So the winter holiday season start on Thanksgiving, which is like the last week of November until like the first week of January, right? So it covers about like 6 to 8 weeks. So during those 6 to 8 weeks, that's when the most of the consumption of calories occurred of the entire year. And that's
Whoa.
when we actually gain the weight that we gain for the rest of the year. So they said that they suggest that the holiday treats may be a key player on that slow, insidious weight gain. Because if you think about it, it could be from like a half a pound to 1 pound or even more, depending. But that's like the minimum that you gain weight. And then it starts to add up in years, right? So 20 years ago, if I add like half a pound, right? So it adds up and it could go up to 10 pounds, 20 pounds. And if you're living with rheumatoid, like inflammatory arthritis, then you know what it does to the joints. Like a slow weight gain, overweight, obesity, that also delays the effectiveness of some of the medications, right? Especially biologics. Even itself, like obesity, is just also a driver of inflammation just by itself. Apparently, the weight that you gain during this time of year, it seems that it's not easy to get rid of for the rest of the year. The most of the weight
Yes.
that we gain occurs in within 6 to 8 weeks during the winter holiday season.
I'm shocked by that. And I have to say, it's really good to hear that because I feel like I actually might print that out and stick it on my fridge or on my pantry because I think maybe we need that reminder that this is a danger period, actually. This next,
Mm-hmm.
from mid-November onwards, it's a danger period and it will have an effect for the whole year.
There is, after the winter holiday season, there's another season that also contributes to like overeating, which is a seasonal affective disorder.
Yeah.
That is all that type of disorder because of the lack of sunlight, vitamin D, and so for many, depression or that time of year leads to eating more comfort foods. So I feel that even for us in North America, that period extends probably until the end of February.
Comfort eating,
Yeah.
I mean, comfort eating is a form of habit, isn't it? We turn to food
Mm-hmm.
because we might be feeling sad or bored or depressed or lonely or whatever.
Mm-hmm.
If you know you're going to eat something indulgent, then you have to match it with one healthy food. Like if you know you're going to eat
Mm-hmm.
I don't know, a gingerbread man cookie or something, then you have to go eat a whole carrot, or you have to go and eat um, like a big piece of protein at the same time. I don't know. What do you think about those kind of techniques?
It does make sense. So during this time of year, you do want to prioritize for those foods that do not contribute to weight gain as much, right? So those will be the foods that are high in protein and foods that are high in fiber. And of course, lots of water and hydration. So I like the idea of pairing that, let's say, we'll say like that treat of fun food, you will say, with something that will kind of balance probably the micronutrients. So you had the gingerbread man, and then on the side you may want to have like a bowl of the Greek yogurt, right, with some nuts, some fruit. right? Perhaps maybe actually start with that and then see if you really want that treat, or actually will have some early satiety. You have your yogurt, your Greek yogurt with a little bit of granola, fruit, or nuts. You eat that, make sure that you take your time, right? I savor it. After that, you may have your cookie, and that may prevent you to maybe eat the whole box of gingerbread men. Work with so many clients when I ask them like, are you just mindlessly eating the cookies or the chocolate just for the sake of it? Like, what is the
Yeah.
purpose of eating that chocolate? What is it that what gives you? What is the comfort? And what does it taste like? And that's what I really like to bring up, like the purpose of mindful eating, that is really taking that time of savoring. And I even had that a client tell me, I tasted that chocolate and it almost tasted like bitter. I didn't want to grab another one.
Yeah, great advice there. It's so, I
Yeah.
mean, sometimes we know this. Sometimes we intrinsically know the right or the healthy course of action, but we don't do it. We don't do it because actually the discipline and the willpower it takes to do the right thing is not easy. And that's why habits are more important. It's more important from my perspective to try and form new habits so that if you do slip up and if you do
Mm-hmm.
indulge, it's not the end of the world. You're not going to beat yourself up because you've got, another few extra healthy habits that will get you back on track. So stop the slippery
Mm-hmm.
slide into the sugar pathway, because you know what it's like. You have one sugary treat and then you want more and you want more and you want
No
more,
more.
because it's designed to be addictive, isn't it? It's designed by the industry to make you want more.
Another thing that I would advise is also sometimes you feel like you're having all these gatherings, maybe dinners, and then you say, you know what, I'm not gonna eat breakfast. I'm gonna be very light breakfast. I'm gonna skip lunch because I'm just gonna enjoy my dinner at the end of the day. That is also a red flag. You wanna make sure that you will still wanna keep consistent with your eating habits, and that actually will help you to not overindulge that dinner, right? So just basically prioritize when you go to that dinner, prioritize what is your high protein meal? Is it the turkey, the roast beef? Because you have consistently eaten throughout the day, you will feel that you're going to be less likely to go for the treats or an excessive indulgence of treats.
So I wonder whether we might just have 2 minutes before we finish to do a
Yes,
couple of quick little stretches in our chair, which
no going.
everybody can do whenever they need it. Whoever is watching this, whether it's live or on the replay, you will see that I'm rolling my chair back. Now, you probably can't see the bottom of my feet. It doesn't really matter. Just remember that you can do this if you're sitting in an airport. It doesn't really matter where you are. If you have a chair, it can be done. So start by taking your arms out long in front of you. Point your fingers away from your body and begin to circle your wrists. Turn them in one direction, clockwise, round and round, and then the other way. And just work with your range of motion. A lot of us have wrist arthritis, so we can't make big full circles. So just do up and down or do what you can. I'm doing it a little faster, but obviously if you have painful wrists, take this nice and slow. All right, and then rest your hands down in your lap. And then shrug your shoulders up to your ears. Take your shoulders back behind you. Take your shoulders down to the ground and then push your shoulders forward. So you're basically doing a very slow shoulder circle. Take them up, take them behind, take them down, take them forward. There we go. You do that a couple more times. And then if you like, you can do it a little faster. And you can even reverse the direction. Help all the blood flow in your arms and in your upper body. Beautiful. You can take your hands onto your shoulders. So you're bending your elbows, hands onto your shoulder tips. So your right hand touches your right shoulder and your left hand touches your left shoulder. There we go. You got it, Christina. And then begin to make circles with your arms. It's like you've got two wings like a bird on the side of you. That's it. And this is another way to make nice circles. Awesome. And then you can stretch, you can link your fingers together and stretch your hands overhead towards the sky, like you're pushing the sky away. Straighten your arms, push, push, push the sky away. Beautiful. And then relax your arms down, shake it out if you need to, and do a couple of little twists just to kind of finish with rotating the spine. So you can take your left hand on the outside of your right knee. Yeah, you got it. Your other hand, if your chair has a back like mine, then you can just rest it on the armrest. But if you don't have a backrest on your chair, you can take your other arm behind your backrest. So it's over the back of the chair, and that will help you twist. And you look over your shoulder. That's it. And so you'll be opening a little bit along the side of your ribs, the side of your body, the bottom of your back.
Okay, got it.
And you like hold for maybe 5 seconds, then you can untwist and go the other way. And then relax. And the very last thing before we finish completely, if you want, you can sit back in your chair. You can hold on to your armrests if you have any, or just hold on to the bottom of your chair seat. Pick your legs up and kick them. Kick your feet towards me. So pick one foot up at a time. Kick me. If you can reach me, kick me. That's it. And you got the blood flowing in your legs as well. And then we'll call it a day there, just in the interest of time. But well done. You did that.
So just a reminder, if you want to get some more tips on how to survive the holidays with healthy eating, a anti-inflammatory tracker, go onto my link and then download the ebook that I have.
Yes, absolutely. Everybody follow that. Subscribe to Christina's newsletter. Subscribe to my newsletter. Go visit my link in my bio. Come follow me. And if you want to do some more yoga for arthritis or inflammatory conditions, come and join us online. You can practice from anywhere in the world. And this is a burning hot off the press. Look out for the online library. There'll be an online studio that I'm launching next year, so you can practice all kinds of yoga with me. Active yoga, chair yoga, standing yoga, restorative yoga, yoga nidra, meditation, breath work, and whether you want to do it for 2 minutes or 5 minutes or 1 whole hour, you'll find lots of things there for you. So very exciting.
That's amazing. Congratulations. Thank you so much, everybody. Bye-bye.
Thanks. Thank you, Christina.